So if you're tuning in, you probably want to, like us, get a quick handle on what really matters in healthcare.
Right. It's such a critical area. Understanding it is key.
Exactly. And if you've ever wondered, how hospitals or clinics actually prove they're committed to quality and safety,
Or maybe what influences that commitment, what pushes and pulls on it.
then you're definitely in the right place. Okay, let's unpack this deep dive into healthcare accreditation.
We've got quite a range of sources lined up.
We do. We looked at the big global player, Joint Commission International, or JCI.
And also India's NABH, that's the National Accreditation Board for Hospitals and Healthcare Providers.
We also checked out insights from a consultancy, Supreme Medic, and a really interesting academic article.
And ISQA, too, the International Society for Quality in Healthcare, a broad view.
So the mission today, really understand what these groups do, why accreditation is, well, such a big deal.
And crucially, how market forces might actually impact the quality of care you receive.
Okay, let's start with JCI. They seem to be a major global standard setter.
They really are. JCI is widely seen as a leader in healthcare quality and patient safety worldwide.
Their mission sounds pretty bold, to enable and affirm the highest standards for all.
It is ambitious, and their reach shows it operating in, over 70 countries?
Yeah, across Asia, Europe, the Middle East, Africa, Latin America.
Yeah.
Over 1,000 accredited programs. It's significant.
It definitely points to a global desire for some kind of recognized benchmark for excellence.
And it seems it's more than just, getting a badge. The stories from JCI accredited places are quite telling.
What kind of things do they highlight?
Well, better teamwork, for one.
Yeah.
Smoother coordination between departments.
Yeah.
That makes sense, right? If everyone's aiming for the same standard.
Absolutely. It forces alignment.
They also talk about stronger risk management, which is huge, and a real boost in community trust.
That community confidence piece is so important.
Definitely. Like Alex Land from Hong Kong Adventist mentioned the excellent training and better communication. And Shiji Kurian in Abu Dhabi talked about gaining a competitive edge. And again, that increased community confidence.
So these are tangible benefits, not just box ticking. It underscores the value of adopting these international best practices.
And JCI seems to offer quite a lot to help organizations get there.
Yeah, it's pretty comprehensive. Beyond the main accreditation, they have specialized certifications now, too. Things like telehealth, even healthcare sustainability.
Sustainability, interesting.
Right. And their international patient safety goals are a core resource. Plus, they do advisory work, publications, education. It's a whole support system.
Creating an environment for improvement? They've even got a big conference coming up, Unified 2025.
That's right, in D.C. Focused on tackling major healthcare challenges, shows they're actively trying to push the field forward.
Okay, so that's the global picture. Let's zoom in a bit and look at India with NABH.
Right, the National Accreditation Board for Hospitals and Healthcare Providers.
It's interesting. They're part of the Quality Council of India, but set up to operate independently.
Yes, a constituent board. Their purpose is very specific to India establishing accreditation programs there and setting quality benchmarks for the Indian health industry as it develops.
That structure functional autonomy, but supported by stakeholders, seems designed for objectivity within the Indian context.
I think that's the goal, to create something responsive to India's specific needs. With leaders like Mr. Koita and Dr. Kochar, the focus seems clearly on building that tailored quality ecosystem.
It really shows how quality initiatives need to adapt locally, doesn't it?
Definitely. Universal goals, but local implementation matters.
Now, how do hospitals actually navigate all this? That brings us to consultancies like Supreme Medic.
Ah, yes, the support system. Supreme Medic positions itself as a partner for hospitals right from the very beginning planning stages.
All the way through to getting accredited.
Which suggests the process itself is pretty complex, needing that kind of dedicated support.
Seems like it. Their services cover a lot. Hospital design, recruitment, setting up quality management systems.
And specifically mentioning NABH and NABL systems, linking directly back to the accreditation bodies.
Exactly.
Yeah.
They also do equipment calibration, general business consulting for healthcare.
And they're pretty clear on the value they bring.
Yeah, they talk about comprehensive service, bringing in expertise a hospital might lack internally.
Which likely saves time and money in the long run.
Right. And ensuring regulatory compliance. That's got to be a big one.
No doubt.
What I found really interesting is their involvement in facilitating investment in healthcare startups, sometimes taking equity as their fee.
Oh, that is interesting. That certainly aligns their interests with the provider's success.
Doesn't it? It kind of brings up the whole interplay of business, market forces, and quality in healthcare.
It absolutely does. And that leads us perfectly into that academic study we looked at.
Right, the one from California. It explored the connection between hospital competition, how they spend their money, and the actual quality of care.
Yes. Focusing on the period after 1982, when California shifted towards selective contracting by insurers.
Which basically meant competition shifted more towards price rather than just quality.
Exactly. Price became a much bigger factor.
Okay, so the core idea or hypothesis they were testing was what? Did this price pressure change how hospitals spent their money?
Precisely. The concern was whether hospitals facing price competition might shift resources towards things patients easily notice, like nicer rooms, better food, the hotel services.
Rather than maybe the less visible but arguably more critical clinical services, things directly impacting health outcomes.
That was the hypothesis. And the findings were, well, quite concerning.
What did they find?
They found that by 1989, in areas with more intense competition, nonprofit hospitals were actually spending less on clinical services compared to 1982 levels.
Less on the clinical side.
And the really troubling part, lower clinical spending was linked to worse patient outcomes, higher risk-adjusted mortality rates.
So cutting costs potentially impacting patient survival.
That was the serious concern raised by the researchers. It suggests
That's sobering. Did they see differences between nonprofit and for-profit hospitals?
Yes, somewhat. The for-profit hospitals in competitive areas showed a trend consistent with the hypothesis, decreasing clinical resource allocation while increasing spending on those hotel aspects.
Competing on the visible stuff.
It looks like it. Competing on observable quality.
And the nonprofits.
Interestingly, nonprofits in competitive areas initially spent more across the board, but that effect seemed to diminish over time.
Suggesting maybe even they felt pressure to shift away from pure quality competition as price became dominant.
That's one interpretation. The study basically concluded with a strong cautionary note. We need to be careful that efforts to contain costs don't inadvertently harm patient outcomes.
A really critical point to consider. Okay, let's widen the lens again. What about ISQA, the International Society for Quality in Healthcare?
Right, ISQA. They're different. A member-based nonprofit focused on promoting quality improvement globally. Been around for over 30 years.
So less about setting standards themselves, more about building the community and knowledge.
Exactly. Their activities are diverse. Education, sharing knowledge, offering external evaluation services, supporting health systems.
And connecting professionals. That network aspect seems key.
It is. They have members in over 70 countries, across 6 continents, truly global reach.
And they have this core belief that really stands out.
Which one is that?
That everyone in healthcare has sort of a dual job. Do your work, but also always look for ways to improve it.
Yes. The continuous improvement mindset. That's fundamental to quality, isn't it? Fostering that culture.
Absolutely essential. And like JCI, they also have a big international conference coming up, Brazil, in 2025.
That's right, São Paulo. Focusing on inclusive health systems this time, still tackling those big current challenges.
Okay, so we have these accreditors, these global networks. But how does this translate into action within a hospital or clinic? That leads to resource allocation, right?
Yes, a very practical consideration. How do you actually use your limited resources staff, time, money, equipment, data to make quality improvements happen?
It's not just about having the resources, it's deploying them strategically.
Precisely. Effective resource allocation is crucial. Our sources highlighted why.
Yeah, things like maximizing impact, focusing resources where they'll make the biggest difference.
Ensuring sustainability, too, so improvements stick and you don't just burn people out.
Right. Empowering teams by giving them what they need. Avoiding waste. Fostering collaboration. It all ties together.
And the process for doing it effectively seems pretty logical.
Like what? What are the steps?
Well, first, you need to actually know what resources you have. Assess your current state, human, financial, tech, space.
Makes sense. Know your starting point.
Then, set clear priorities. What improvements matter most right now? Base that on data, on potential return on investment.
And get people involved right. Key stakeholders.
Crucial. Get buy-in, ensure alignment. Then you create a detailed plan.
The who does what, by when, with which resources plan.
Exactly. Responsibilities, timelines, assigned resources. And finally, and this is key, track and monitor.
Don't just set it and forget it.
No, you need to see how resources are being used, collect data, and be ready to adjust the plan if needed.
We even saw mentions of tools that can help with this, like software for workforce management or budgeting.
Yes, project management tools, data dashboards. Things to make tracking and managing easier.
So, pulling all this together, it's quite a landscape. Accreditation bodies setting standards, market forces potentially pulling in different directions.
Hostile networks, fostering improvement, and the practical need for smart resource allocation within organizations.
It leads to a really interesting question for you, the listener, to think about. As you consider all this, what seems like the most critical element for achieving both high-quality care and efficient systems?
Is it the rigor of those accreditation standards, like from JCI or NABH?
Or is it getting the balance right with market forces, like that California study highlighted?
Or maybe it comes down to how well individual organizations strategically use their own resources for quality improvement.
It really makes you think about how interconnected all these factors are in the push for safer, better healthcare, doesn't it?
It certainly does. Something worth exploring further in your own context.